Our history treating patients with recurring SIBO, that small intestinal bacterial overgrowth, has been pretty fascinating. When it started out with physicians calling us from Portland, Oregon, saying, "What are you doing with our patients?" We said, "What do you mean?" They said, "Well, you saved this one woman's life. It really got our attention." I said, "What are you talking about?" "Well, she has SIBO, and the medications she was taking, the antibiotics we were prescribing, seemed to be working for us, but they'd be working for a short period of time, a few days, maybe 2 or 3 weeks, and then the SIBO would come right back. In this case, it was eating her food. But she happened to go to a clear passage facility, and suddenly the medications are working. What in the world is going on here?" So they flew down from Portland, Oregon. I got them together with our PhD and the chief of staff at the hospital. We all looked at it and we said, well, what we do is we clear adhesions, among other places, in the bowel. We determined that what was happening for so many people with recurring SIBO is that they have this bacterial overgrowth in their small intestine where it shouldn't be. It is treated with an antibiotic, but the SIBO bacteria that's left, the few that have not been killed by the antibiotic, are stuck there, so they reproliferate. When we treat a person with recurring SIBO, we like them to have their physician prescribe their antibiotics simultaneously, because as we treat and free adhesions, that SIBO apparently flushes out of their system and in many cases is gone. So that's what we do for SIBO.